this month, we here at KPRC2 are celebrating May Heroes, and today we are saluting our frontline workers who have cared for mothers, fathers, sons, daughters, and countless others. This week is National Nurses Week. Good afternoon, and thank you for joining us. I'm Andy Sirota.
And I'm Lisa Hernandez. Thanks for spending a moment of your day with us here. We're live here at John P. McGovern Texas Medical Center Commons to honor our healthcare workers.
That's right. Leading our coverage is KPRC2's Haley Hernandez, Houston's only on-air health reporter.
And Haley, you are with the president and CEO of the Texas Medical Center this morning.
Yeah, guys, so he obviously has an extraordinary leadership role. Bill McKeon, he's joining me now live. But during the COVID pandemic, he and I were just chit-chatting that so many people trusted their lives based on the information that came out of here at the Texas Medical Center. And you have been keeping a close eye on the numbers. Through your leadership, we have known exactly how much of the virus was in our community. And just tell me, let's talk a little bit about that. What were some of the challenges that you guys faced throughout the whole pandemic?
Sure. Well, welcome to the Texas Medical Center.
Thank
and actually,
you.
Behind this water wall is the first meeting we ever had was in the Texas Medical Center boardroom. And we brought all of the leaders here at the Texas Medical Center together. And that was in February. That was 13 months ago when the virus was still in Wuhan, China.
Right.
And we really came together at that time and made a decision that instead of operating as separate entities, we were going to bring all of our data together in real time. So we formed a war room here. And every day we'd pull that data several times a day from all the medical centers, so we knew how many patients we were treating, how many people we had tested, and now how many people we vaccinated. And it was really all the difference because we had real-time data where around the world, sometimes in other parts of the state, they were waiting 4 to 5 weeks to understand really where the virus was.
Yeah, and so the danger with that is that you wouldn't know if there was a surge happening around you. And as you called it the war room, because we were at war with this virus. We are at war with this virus, right?
Absolutely, and like all wars, you win on intelligence and supply chain. So one of the things that we also did is we brought our supply chain purchasing of personal protection equipment, all of the ventilators, all the tools that we needed. And you heard in other parts of the country, sadly in other parts of the world, they ran short of those. We never did here because we really started to do that and purchase on bulk and share that data in real time.
I was going to say, Houston did well when we did look at that. We worried about ventilators not being available. We worried about our staff, our hospital staff getting sick. And would you say that we didn't really see it happen?
We certainly came close to bringing to the limitation of how many beds we have here. But one of the beauties of the medical center is because we treat so many patients from around the world, we had excess capacity that normal hospitals wouldn't have. But because we have the leading cancer center and children's hospital and cardiovascular program.
We use all of those.
We were. And so, but it really took us to be very thoughtful and mindful about utilization of those resources, and it was done collectively across the city.
And now we have enough vaccines for everyone in our community. I know that you and I are able to sit here across from each other outdoors without a mask because we're both vaccinated. So any last word to the public about getting vaccine, getting through this thing because of vaccine?
I think what a lot of people would be surprised to find is every day we admit about 100 patients, COVID patients, into our hospitals. And what's unique is now they're all under 50 years of age for the most part. 20 to 50 years of age. And these are the people that think for some reason they don't need to be vaccinated. And it's really sad to see because we have the supplies available. You can get vaccinated in a day, 2 days now. There's no wait. And so I really hope people will really rethink this because the sooner in which they lean in to that, the sooner we're going to be returning to a life of freedom. Now we have vaccines coming out for our children. You're going to see both the Pfizer vaccine and Moderna just came out with data today. So pretty soon we're going to be vaccinating our children this summer so they can return to school knowing they'll be free of COVID.
Yeah, I think we could see it happen as soon as the fall. Mr. McKeon, thank you so much for joining me. And in your honor, we're going to be paying it forward to a healthcare worker who has worked tirelessly throughout this pandemic. So we appreciate you being here and for all the work you do.
Well, thank you for the great reporting you've done all along. It's been factual, and that really helped the public to really understand the decisions they had to make.
Thank you. I'm honored that you say that. Thank you very much. Andy and Lisa, we'll toss it back to you.
All right, and to thank you, Mr. McKeon, for your hard work. KPRC2 and Uptown Houston would like to give you executive passes to give to your staff for a show at AD Players.